I'm Catherine. This is going to be the cranial nerve assessment video. So, the first cranial nerve 1 is for the smell, and we are not going to test that today. And cranial nerve 2, I'm going to have you cover the eye. So, please look into my eye, and then I'm going to hold up numbers, and please tell me how many numbers I'm holding up. Keep looking in my eye.
2.
Okay, how many?
3.
Good. And then we're going to cover the other eye. Good. And how many numbers am I holding up?
1.
Good. How many?
2.
Good. And then I also would have, for cranial nerve 2, I would have the patient stand 20 feet away from the Snellen chart, and I would have them cover up one eye and read the lowest line that they can without missing 3 of the letters.
DEQMRS.
Okay, so he successfully read that line without missing any letters, and cover the other eye and then read the lowest line that you can.
DEQMRS.
Good, and then read the lowest line you can with both eyes.
DEQMRS.
Good, and then I should have asked, but do you wear contacts or glasses?
No.
Good, and if he did, then obviously we would want to have him wear those during the test to have him succeed as much as he could. So whichever line that he did read, it has a number next to it, like 2020, 2030, and that would be his visual acuity score. If he had missed more than 3 or more of the letters, then he would proceed to the line above that with larger letters and try to read that, and that would be his visual acuity score. So that is cranial nerve 2. Cranial nerve 2 is intact. Cranial nerve 3, I'm going to have you follow my pen light with just your eyes. Good. So during this, I'm looking for any extraocular movements, which we would call nystagmus, and there's none of that. Now I'm going to look at the pupillary light response. I'm going to shine my pen light in your eyes. I'm going to look at direct first. Good. Like, look at something behind me, please. Very good. And I'm going to put my hand up here and look at the indirect response. Keep looking at something behind me. Very good. Good. So pupils are equal, round, reactive to light. They are about 2 to 3 millimeters. I also am going to, that's cranial nerve 3, so cranial nerve 3 is intact. And then I'm going to have you follow my pen light, adjust your eyes. Good. So that is cranial nerve 4, and that's accommodation. That's the A at the end of Perla. His eyes came inward and then down. Cranial nerve 5 would be, I need you to open your jaw against resistance on my hand, and then clench your jaw, and I'll feel that your muscles are equal. I would also test for sensation on your face, your scalp, and your cornea with a cotton ball, but we're not going to do that today. So that's cranial nerve 5. Cranial nerve 6 is the lateral movements of the eyes, which we already tested that with cranial nerve 3, which is intact. Cranial nerve 7. I keep getting tied up on 7. Cranial nerve 7 is chewing. Muscles of mastication. Open your mouth. Say my name.
Catherine.
Smile. Good. You did that voluntarily. And frown. Good. Close your eyes and open them. Good. And then also with cranial nerve 7, you would test for tears, salivation, and tears, salivation, and there's something else. Those are the sensory part of cranial nerve 7. Cranial nerve 7 is intact, but we don't test for the sensory part right now. Cranial nerve 8 is auditory. for the hearing nerve. So it's a whisper test, and we would plug this ear, and then I'm going to whisper a 2-syllabus word, and then I need you to repeat it to me, okay?
Okay.
So.
Sunshine.
And then I'm going to do that on this ear.
Baseball.
Good. And then also with cranial nerve 8 is the equilibrium as well, which we would test with somebody's gait, but we're not going to test that now. We'll test that later on. So cranial nerve 8 is intact. Cranial nerve 9, I would have the patient say ah.
Ah.
And then also test the gag reflex. But we're not going to test that right now. So cranial nerve 9 is intact. Cranial nerve 10, I would have the patient push against, like test the muscles of the face and the neck and shoulders. So I would have the patient push against my hand, push against, good, and again, and down, and then back, push back, sorry. So we did side to side and back and then down, and then on your shoulders, lift up, good. So that was cranial nerve 11 is intact. And then cranial nerve 12, stick your tongue out and then stick it side to side. Good. Cranial nerve 12 is intact. And that is the cranial nerve assessment.